For most children, the trach tube is changed once a week. When doing a trach tube change, have a phone nearby so you can call for help if needed. This is just a precaution, as most trach tube changes go smoothly. Start by washing your hands. Clean hands are the best way to prevent spreading germs. Gloves are optional. Once you finish washing, you'll want to gather these necessary supplies. It is important to make sure that you have all of your supplies easily within reach before beginning any care. Here are the supplies you'll need. A clean, stable work surface near the child. The same size trach tube with obturator. Smaller size trach tube with obturator. 2 5-milliliter syringes. These are only for children who have a trach with a water cuff or air cuff. If your child has a trach with a water cuff, you'll need sterile water as well. Water-based lubricant. Velcro trach ties. Scissors. Tweezers or a clamp. Saline bullet. Suction catheter. Self-inflating ambu bag connected to oxygen and face mask. Blanket roll. And a suction machine. Be sure to check the ambu bag to ensure that air is flowing properly. Open the trach tube container. Inspect the trach tube to make sure there are no cracks or tears. If you have a cuffed trach tube, test the cuff. Inflate the cuff and make sure it holds the air or water, then deflate the cuff completely. Measure the trach ties as they may be too long and need to be trimmed to fit properly around your child's neck. It may be necessary to trim the ends of the ties so that they pass easily through the wing holes. Attach the new trach ties to one side of the new trach tube's wing holes. You may use either twill or Velcro depending on your home care supply company. This video shows the Velcro tie. Please see our other video for a demonstration on how to change the twill. You will insert the obturator into the new trach tube. This is a device that sits inside the trach tube to create a rounded, gentle tip that enables the trach tube to pass easily into the stoma. Moisten the new trach tube with a small amount of water-based lubricant and place the trach tube back into the clean tray or clean container. Place the blanket roll behind your child's shoulders to get a view of the neck and tracheostomy site. Whenever you perform care of the tracheostomy, it is important to check to make sure your child is breathing comfortably. If they need suctioning, do this before you release the trach ties or remove the trach tube. If your child has a cuff, remove the air or fluid to deflate it. Then, while stabilizing the trach, release one side of the trach ties. Gently remove the old tube and insert the new tube right away. If it does not easily go into the stoma, never force the tube. Remove the obturator from the trach tube immediately so your child can breathe. Secure the trach ties. Inflate the cuff if your child's trach tube has one. Check the trach tie on both sides of the neck for fit. You should only be able to fit one pinky finger between the skin and the tie on each side to assure the ties are not too loose. Look and listen to your child to make sure air is moving normally through the new trach tube. Your child may cough with the trach tube change. This is normal. Suction the tube if necessary. If you are unable to reinsert the new same-size trach tube easily, use the smaller trach tube as an emergency backup. Refer to your emergency training for more instructions. Now that the trach is secure, you can perform trach site care. Depending on your home care company, you may be instructed to clean the old trach tube with soap and water and reuse it at the next trach change. Be sure to clean and keep the obturator as well. Once the trach tube is completely dry, store in a dry container for reuse.